So, IVF, which is in vitro fertilization, is a treatment for women who are not able to conceive spontaneously, and it's quite expensive. It's time consuming. It's very stressful physically and emotionally, and certainly um, before going through that, you want to, optimize your chances, right? You want to make sure that
Mhm.
everything else is sort of as perfect as it can be, so that IVF works. And sometimes it doesn't work, and we don't know why, right? With everything being perfect. But at least if you know that there's large fibroids, why not have them removed before going through fertility treatments? And sometimes fertility doctors will recommend that, and sometimes they don't. I mean, we've certainly seen patients come to us after they failed multiple IVF cycles, coming to us and saying, I have these fibroids. I wasn't told that I need to remove them, but I'm thinking, maybe I should because something else is working. And
Mhm.
sometimes they're very sizable, and they're actually in the location where they should be impacting fertility. Could that be the only cause of their failed IVF? No, I mean, no one again knows, right, what the issue really is. But again, you really want to optimize your chances. And if you're going to take out small polyps and any other things from the uterine cavity before going through fertility treatments, why not take out a large fibroid in the muscle of the uterus that's pushing onto this cavity, and causing some distortion? So I really think that, and the biggest kind of concern that fertility doctors have is that I send this patient for fibroid removal. They have the surgery and they have complications, and then the uterus is completely not the scarring or whatever the issue is.
Right.
And that certainly is a risk with any surgery, right? You can develop infection or any complications, and that is a reason to go to a specialist. So in the hands of a specialist, um, the risk of complication, the risk of scarring to the uterus, and all these things are much lower. Um, and that's another reason not to wait, right? So if you don't delay care, and if you don't have these enormous multiple fibroids, your chances of us being able to remove those fibroids, reconstruct the uterus, and the uterus still be functional is very good. A lot of times patients ask me, um, what's your success rate, or
Mhm.
how often do patients get pregnant? And it really varies. I think age is one, of course. If you're in your 40s, you could have a perfect uterus but never get pregnant because of an ovarian issue, right? So there's a lot of factors. But another factor is how many fibroids there are, how big they are, and that's directly related to, I think, delay in care and really waiting, instead of getting these addressed sooner. So I think if you have a diagnosis of fibroids, even if you think they're small and you're really not planning on doing anything about it at this moment, I think you should consult with a specialist, so that you can get the right opinion.